Hi, I'm Dr. Max. I'm a full-time hair transplant surgeon and a diplomat of American Board of Hair Restoration Surgery. I came across a video on the internet that gained a lot of popularity recently because it did show a US doctor who traveled to Turkey meal clinic for hair transplant. Obviously, this video mentioned the name of the clinic and looks like it was made for the marketing purpose. I thought it might be a good idea to give a response from a hair transplant surgeon to some of the content that I've seen during this video. So let's go ahead and take a look.
Dr. Joe Hummel is about to fly overseas for a new head of hair. It's a long flight, 9 hours. And when Dr. Hummel arrives, he's with two good buddies, Chris Arbatina and Joe Massimino. They're also getting the procedure done. So where have they landed? Istanbul, Turkey, the gateway to the East.
Turkey is a very popular destination for hair restoration and also emerging aesthetic procedure market. Partly it's the price that they offer, and secondly there's less regulation in Turkey of whom can open the clinic and run the clinic.
Bright and early the next morning, the three amigos brace themselves for a full day of surgery.
Hair for all! Hair for all! Equal opportunity hair!
Driving across Istanbul, they make their way to the Estanove Hair Clinic. More than half the patients come from the U.S.
This doctor actually traveling from the United States to Turkey to get, as the commentator says, a full head of hair. So actually looking at him, he's actually Norwood 2, maybe 3 as a progression of the hair loss. To say a new full head of hair, I don't think it's really accurate.
Why Turkey of all places? Well, the costs. In the U.S., hair transplants can cost $15,000 or more. But the clinic in Turkey charges about $4,000, and that includes a 5-star hotel stay.
Also, regarding the pricing in the United States, it is important to understand that most of the time, clinic will charge price per graft. It's not always $15,000 or more, because it's actually how many grafts do you need.
What about the quality? Dr. Hummel says he's not concerned.
I had two friends or clients of mine actually come to this clinic and had amazing results, and I've been thinking about doing it for a few years, and after seeing their results, I reached out.
When choosing a right clinic for your hair restoration, it is important, of course, ask for reviews, ask people who had a procedure done, but also try to make your own research, because it is important to investigate who does the procedure in the clinic and what the doctor's involvement in the actual surgery is.
Hello, good morning.
They consult with Dr. Zafer Çetinkaya, who maps out a surgical plan.
It looks like a doctor in Turkey is actually reinforcing the existing hairline instead of trying to reshape it.
After a quick buzz cut, it's off to the operating room to begin the extraction of the donor hairs under local anesthesia. Dr. Hummel and his friends are having existing hair follicles removed from the back of their head and implanted into the bald spot.
So here's a commentator mentioned that the hair being harvested one by one and then implanted into the bald spots. They use very generic device to extract the hair follicles. As you can see, there is a coiled wire coming out, which not is even covered with any material. And it looks like this device is being used repetitively during different surgeries. It does raise concern about infection control because you cannot really sterilize this coiled wire. Additionally, now we have much more advanced devices for hair restoration, such as WA device, Tribellini, Artes, and others that are much more superior. And using such a generic device might not yield you the best results. You can see that assistant, not the doctor again, extracting the hair follicle, but the assistant is not wearing any surgical magnification device, such as surgical loops or a microscope. And it's absolutely essential to be able to harvest those hair follicles precisely, because you need to really align your punch with the direction where the hair is growing. And unless you do it, you can really see a lot of transection rate. And that's, by the way, the most common problem in people who come back from Turkey, and it is depletion of the donor area. Looking at the video, it appears doctor delegated implantation to 3 different technicians. And this method is called a pre-made incisions. So he made small slits in the scalp, and then 3 technicians finishing up the job implanting 4,700 grafts one by one. The problem with this method is when you use forceps, there's a lot of potential damage that can occur to sensitive graft anatomy if the graft is not being held properly and inserted properly. It can damage sensitive areas such as bulb or bulge area of the graft and resulting in less than favorable results. For this reason, in my clinic, I prefer using sharp implanters and implanting every graft with my own hands. Thus preventing potential damage and less than favorable results.
As Dr. Zafer operates, his assistant uses a counter on her phone to tally the number of incisions.
So here you can finally see the doctor actually doing something surgical, and it looks like he creates incisions for the grafts to be implanted later. And the assistant for the doctor counts every time he makes an incision. Here he's using, looks like a Zeiss optic to create it. But again, I think this type of magnification device even more important to be used during FUE or follicular excision harvesting.
In total, 4,700 grafts will be implanted.
This doctor in Turkey made over 4,700 incisions, and looking at the picture of the patient, most of these grafts went into the frontal area. My concern here is it's probably too many for the frontal hair restoration. In my practice, I typically use about 2,000 to 2,500 grafts in order to restore frontal area, hairline, and the mid-scalp. So I think it's a little bit overshoot taking 4,700 grafts.
The patients are bandaged and given precise aftercare instructions as they heal from the transplant. A 5,000-mile journey, all for a new head of hair.
So in summary, it is okay to go to Turkey or overseas to have your hair transplant. But it is important to make your own research about who actually does the procedure. Most of the time, you can encounter that the doctor is not really the one standing beside you and performing every step of the surgery. And it is important to make sure that only the doctor with proper qualification will be performing your procedure. It was Dr. Max. Thanks for watching. If you like it, please subscribe.